ADHD, it's really rising these days. There's a lot more kids being diagnosed and medicated for this condition than there used to be. And again, it's considered to be one of these genetic medical conditions. Let's say I hadn't had lunch, okay? I have had lunch, but let's say I hadn't, and you were holding a chocolate bar in your hand, okay? And I'm really hungry. I might have an impulse to grab that chocolate bar and bite into it. That's the impulse. Anything wrong with having the impulse? No. Would there be something wrong if I acted it out? Yes. Okay? So there's nothing wrong with having the impulse, but that's okay because there's a part of my brain, and I'm pointing at it actually, it's right here, one of whose jobs is to regulate impulses, which is to say, Gabor, not right now, it's not your chocolate bar. Maybe you shouldn't be eating chocolate right now. That's impulse regulation. Addicts have very poor impulse regulation, and there's an even larger number of people, huge number of human beings, who completely lack self-regulation. And who are those? Children, young children. What does that tell us? It tells us that nobody is born with impulse regulation. It has to develop. And maybe when we look at these conditions such as ADHD, oppositional defiant disorder, or a whole range of conduct disorders and addiction, we're not talking about diseases, we're talking about a developmental problem. Maybe things just didn't develop the way they should have. Or when don't things develop the way they should? If you're a gardener and your plants are not developing the way they should, the way you expect them to, what's the first thing you would look at? You would look at the conditions. Too much or too little sunlight? Too much or not enough irrigation? How about the quality of the soil? You look at the conditions of development. And if you wanted those plants to develop properly, you would fix those conditions. You wouldn't try to treat the plants for some kind of disease most of the time. You'd be looking at the conditions for development. Well, how if we recognized that most of the problems that people are troubled with are actually problems of development? And it's those developmental conditions that we need to look at. And then we'd be asking ourselves, what are the conditions in this society that lead so many people to have a failure or a slowing down of the impulse regulation circuitry and capacity? That's the first point. So it's a developmental problem rather than a medical problem per se. Number one. Number two, if you look at the tuning out of ADD, why do we have this capacity to tune out? I mean, nature gives us that capacity. Why do we have that capacity? There's got to be some reason for it. And it's easy to demonstrate. Anybody know what the reason is? Protection from overwhelming stress, right? Now, here's the deal. If I were to stress you right now by becoming abusive or threatening, what options would you have? You have the options of standing up and telling me to shut up, to stop talking to you that way. You also have the option of leaving. So you have the option of fight or flight. And if you couldn't do either, you would also have the option, given that there's many dozens of people here in the room with you, you'd have the option of asking for help. But what if I were to stress one of you and you didn't have the option to ask for help or to escape or to fight back? Then what would you do? Well, you wouldn't do anything. And so freezing is one option, tuning out is another, just going absent-minded, dissociating in other words. Then you wouldn't have to feel the pain and the stress. Well, you can see, I might have lots of reasons to tune out as a 1-year-old, as a 2-month-old, as a 3-month-old. So maybe it began as a coping mechanism. Maybe the ADD also begins as a coping mechanism. You may think you're here because somebody in the family's got a problem and you're here to help them. What I'll be telling you throughout the day is that actually each one of us is here for ourselves. There's tremendous healing possible. Is anybody ever really whole? Yes, they can be.